Welcome, Fiona.
Thank you.
Could you tell me when you first noticed MS symptoms?
In 1979, I had pins and needles in my feet, and I went to the GP, and he was a particularly good GP. He didn't say anything, but he said he would just put me into Aberdeen Royal Infirmary to be examined. I went and I saw a doctor who I had that, he tested with the legs and what have you and the movements, and then it disappeared. The pins and needles disappeared. So when I went back to see my GP, it had gone, and he said to me, that they were looking into the fact that you might have MS, and because he didn't go on to say, and that's what they think you have, I just assumed that they had looked into it, and I didn't have it. So I went for 20 years, till 1997. Now, prior to the 1997, I was becoming, a bit tired, and I was working full time, and I was just a bit stressed and tired. But we put it down to menopause. And then in the summer, in the August of 1997, I was in Glasgow at a conference, and on my way home, I developed optic neuritis, without going into too much detail. So I saw the doctor again, and because the original doctor had retired, the younger fellow, he didn't think in looking back in the notes, and he just, I saw a neurologist, I think within 2 days. Now, during my conversation with her, she said, years ago you had this sort of thing, and I said, oh yes, and they thought that perhaps I had MS. And she said quite bluntly, well, I think that's what you've got. So to cut a long story short, that was it. That was in 1997. I had the lumbar puncture, and I had the steroids, and I had a CAT scan, but there was nothing. My brain was clear, and so I just had, I think it was 3, which was the treatment then of intravenous steroid, and so I just carried on, and really my mobility, it wasn't too bad, and I worked for another year, but in the meantime my husband died, and I just thought, right, and I never told the people at work that I had MS, and I went back maybe too soon after the diagnosis was made, and but having said that, my husband died, and we're on the farm, so I worked for about 6 months after he died, and then I thought, that's it, I just gave up work, and I came home. And we've been farming ever since. So in theory, my general health is quite good, but my mobility is the thing that slows me down. I walk with a stick in the house, I use a rollator when I'm outside, and apart from that, I'm not too bad. Now, how I knew, so I'd had a pretty busy lifestyle, or maybe a stressful lifestyle, because our son died in 1985. So, there was always a bit of stress along the way. But when did I, no, that was 97. So my own GP, and there was no treatment. And they couldn't offer me anything. I think I did try baclofen, but it didn't suit. And it was just left, so I was just getting on with it. And then I have a reflexologist, and she came, and she mentioned a patient about this LDN. And so I got in touch and I was given the address of Dr. Lawrence and the telephone number. So I phoned Dr. Lawrence, and initially I think he was so kind, and I think he thought, oh gosh, I've got enough to do. He had so many patients. But after he heard the tale of woe, he said yes, he would supply me with LDN. So I think, I'll be honest, maybe 6 or 7 years to see the years pass. And Dr. Lawrence was always a tremendous help and a great, he was always kind and whatnot. So it came as a bit of a shock when I heard from him that he could no longer supply the drug. But in the meantime, he told me about Dr. Gilhooly. So, of course, I'm up here in Aberdeenshire, and Dr. Gilhooly's in Glasgow. So I made an appointment to see Dr. Gilhooly, and we established a rapport, for want of a better term. And I telephoned them. I've seen him a few times, and then I have a telephone consultation, and that's where I get the LDN now, and have been for a while. And I'm really grateful to them. I also take Dr. Gilhooly's supplements, you know, his AM and PM, and I take 3,000 milligrams a day of the, dash it.
Yes.
You know,
the EPA.
Yeah, exactly, in a nutshell. So I've been taking that for years too. And so I'm here still on the farm, mentally relatively sound, though of course getting older because I'm now 68. That sometimes, you know, when you have the blink, you think, oh dear, is it the MS or is it just age? But I'm lucky in comparison to many. But I think the LDN, what it's done for me, it has stabilized the situation, and I think it calms me because I'm a person that would worry about nothing. And of course, I think that's genetic, but you know, but I think it has a calming influence. And I'm now just taking 3 milligrams. I've been taking 3 milligrams. I was 4.7 for a while with Dr. Lawrence. Then we went to 3.7, and then because I became very tired and sort of, you know, I came down to 3 milligrams, and I take a capsule of 3 milligrams daily, and I have been on that for maybe a year or two. And so that's really my story. My GP, I tried to speak to the GP about it, but they said no, they couldn't give it because, to be fair to her, she wrote to the neurologist who said no, they weren't going to. They couldn't recommend it. I was prescribed LDN. So I have to get it, as like everyone else. So when I go to the practice, because I fibrillate, I have atrial fibrillation, but again it's asymptomatic, but it's there. So when I go and see them, they'll speak about everything, but we just don't speak about the LDN or the MS very much.
Okay.
And to be honest, I don't see the doctor very much. You know, I sort of keep going myself, if you know what I mean.
Could I ask what? Sorry. Can I ask what symptoms?
Sorry?
Good job this is being edited. We both keep talking there. Could you tell me what symptoms LDN has helped with?
Well, I think it was just that it stabilized me because I didn't have many symptoms. My main symptom is mobility. And it's definitely not as good as it was in 1997. I mean, but of course, there's the aging process going on here, too. But, so I can't put my finger on it. But the thing is, I'm still functioning in the business. I do the bookwork side. And, you know, so there's a lot of pluses. I don't think there's been, no, it stabilizes the word, I think. It stopped me going down the slippery slope.
Good. Did you have any introductory side effects when you first started?
Not that I'm aware of. It's mind you, the dreaming's quite something. You get these sort of dreams, but I just cope with that too. No, but I didn't have side effects.
Good. Well, thank you very much, Fiona, for sharing your story with us.
Not at all. And I just hope that we can continue getting it. Because I don't think it's so sad when they can't give you, when the general practice, when they can't give you anything else, that they can't see their way to helping us, you know, with something that is obviously helping us. You know? But it's just the way things are. I think no one wants to offend a neurologist. That's what I understand. Well,
any doctor can prescribe LDN on the NHS if they so choose, and there are quite a few that will, but they have to take responsibility for it.
Well, you see, that's it.
Yeah.
But I wear I'm part of Medical Alert. I wear the bracelet all the time, and it says that I have the MS and that I'm on the Low Dose Naltrexone, and you know, so it's there.
Yes.
If anything was to happen to me and I was on my own.
Yeah.
It's never off my wrist.
Do you think I should have a photograph, Fiona, please?
Of me?
Yes.
Oh, gosh.
Or would
Well,
you
yes.
like me to use a stock photograph, a library photograph?
Yes. Well,
It's up to you.
I'll try and get something relatively up to date.
Okay, that would be good.
Well, but you know,